The mediators involved in type 1 hypersensitivity allergic responses are released from mast cells, plasma cells, or monocytes.
Mast cells?
Very good. Genetically determined hypersensitivity to common environmental allergens cause blank reactions, such as atopic urticaria, autoimmune diarrhea, or IgM-mediated infections.
Sorry, can you repeat the question?
Sure. A genetically determined hypersensitivity to common environmental allergens cause blank reactions. Atopic urticaria, autoimmune diarrhea, or IgM-mediated /infections.
Urticaria.
Very good. Mismatched blood transfusion reactions with hemolysis of blood cells is an example of type 2 blank-mediated hypersensitivity reactions. T-cell, antibody, leukotriene, or complement.
This is talking about blood transfusion, right?
Mm-hmm.
Incompatibility. Is it the leukotriene?
Very good. Type 3 hypersensitivity immune responses can be harmful when immune complexes deposit in tissue activate blank that can directly damage area of tissues.
Sorry, can you go back?
Sure. Type 3 hypersensitivity immune responses can be harmful when immune complexes deposit in tissue activate blank that can directly damage tissues.
Type 3. I don't know this one.
Inflammation, autoantibodies, cytotoxic cells, or immunoglobulins.
You said type 3, right?
Mm-hmm.
What were the choices? Inflammation?
Inflammation, autoantibodies, cytotoxic cells, immunoglobulins.
I'm going to go with inflammation.
Very good. Shortly after being diagnosed with HIV, a patient has begun highly active antiretroviral therapy. What is the primary goal of the patient's drug regimen? To limit the latent period of HIV, to slow the progression of the disease, to minimize opportunities for the transmission, or to prevent seroconversion.
What was the third one you said was prevent, right? Prevent what?
To prevent seroconversion. That was the fourth one, though.
Oh.
The third one was to minimize opportunities for transmission.
I think it's slow. The second
Very
one.
good. A patient has been admitted to the hospital for treatment of HIV infection, which has recently progressed to overt AIDS. Which of the following nursing actions should the nurse prioritize when providing care for the patient? Frequent neurologic vital signs and thorough skin care, hemodynamic monitoring and physical therapy, careful monitoring of fluid balance and neurologic status, or astute infection control and respiratory assessments.
What was the first answer again?
Frequent neurologic vital signs and thorough skin care.
No.
We're talking about AIDS.
Right. What was the last one? Respiratory?
Astute infection control and respiratory assessment.
Sorry, can you go over all four answers again?
Sure. You want me to read the question?
Yeah.
A patient has been admitted to the hospital for treatment of HIV infection, which has recently progressed to overt AIDS. Which of the following nursing actions should the nurse prioritize when providing care for this patient? Frequent neurologic vital signs and thorough skin care, hemodynamic monitoring and physical therapy, careful monitoring of fluid balance and neurologic status, or astute infection control and respiratory assessment.
I think it's the last one.
Very good. A patient was diagnosed as HIV positive several years ago. Which of the following blood tests most clinically useful for determining the stage and severity of the disease? Plasma levels, CD4 cell counts, viral load, or white blood cell count with differential?
CD4.
Yeah. Which of the following would constitute a normal assessment finding in a neonate? Minimal or absent levels of IgA and IgM, absence of plasma cells in the lymph nodes and spleen, undetectable levels of immunoglobulins, or absent mature B cells with normal T cells and function. Absent of mature B cells with normal T cell levels and function.
I think it's that one.
A.
AGA?
Minimal or absent levels of IgA and IgM.
Oh, yeah, you're right. AGA is the ABC bile breast milk. Okay.
Although growth rate is variable among types of bacteria, the growth of bacteria is dependent on biofilm communication, availability of nutrients, an intact protein capsid, or individual cell motility.
What was the question asking with bacteria?
Although growth rate is variable among types of bacteria, the growth of bacteria is dependent on biofilm communication, availability of nutrients, an intact protein capsid, or the individual's cell motility.
The nutrients?
Right. I can't even say this. It's Treponema pallidum. The cause of syphilis is a spirachate bacterium that is spread from human to human by tick or lice vector bites, direct physical contact, or exposure to infected urine.
What disease? Sorry, you got me on that.
Syphilis.
It's not the tick bite. What were the? It's human fluids.
Direct physical contact.
Yes.
Because these words are hard today.
Yeah.
Because dermatophytes are capable of growing blank, the infection is mainly found on cutaneous surfaces of the body. A powdery colony in moist skin folds, on cooler tissue, or branching filaments.
What was the actual question?
Because dermatophytes are capable of growing, the infection is mainly found on cutaneous body surfaces.
Right.
A powdery colony in moist skin folds or on cooler tissues. Let me get the answers.
Yeah, this is the one with skin, hair, or nails, right?
Mm-hmm.
So it's going to be the powdery thing with the tissue folds.
Right.
Yeah, so I didn't know about the wood test where they kind of use like a ultralight sound thing to check your hair or your scalp.
Oh yeah. a second. I lost it. A public health nurse recognized that sexually transmitted infections are typically spread by which of the following mechanisms? Penetration, vertical transmission, direct contact, or ingestion?
Direct contact.
Yep. International travel has contributed to increase in prevalence of and incidence of non-indigenous diseases by increasing which of the following? Portals of entry, sources of infection, virulence, or disease course?
Portals of entry.
Sources of infection.
So, did you said sources of infection?
Mm-hmm.
Why isn't it portals of entry? Because that's talking about
International travel.
Okay. So if it was talking about portals of entry, would that mean like the question would be more like a person who's in a facility and they're in isolation or whatever?
Right. So it would, if it was talking about portals of entry, it would not have international travel and it would not have non-indigenous diseases. Those two things right there say that it's a different source of infection.
Okay. Okay.
A patient has begun taking acyclovir, an antiviral medication to control herpes simplex outbreaks. What is the drug's mechanism of action? Inhibition of viral adhesions to cells, elimination of exotoxin production, or interference with viral replication processes?
Elimination of exotoxin.
Interference with viral replication process.
What? Interference. I guess that makes sense.
A patient's primary care provider has ordered direct antigen detection in the care of patients with serious symptomology of unknown origin. Which of the following processes will be conducted? Growth of biofilms on various media in laboratory settings, quantification of IgG and IgM antibodies in the patient's blood, or introduction of monoclonal antibodies to a blood sample from the patient?
You said septimology, right?
Mm-hmm.
Is it the growth?
Introduction of monoclonal antibodies to a blood sample from the patient.
Blood sample. So it's the last one?
What's the answer? Introduction of monoclonal antibodies to a blood sample from the patient.
Right. Is that the answer?
Mm-hmm.
Oh, okay.
A patient with a long-standing diagnosis of Crohn's disease has developed perianal abscesses. Which of the following treatments will the patient most likely require? Antiviral therapy, antibiotic therapy, or surgical draining?
You said Crohn's disease?
Mm-hmm. And they have perianal abscesses.
What were the choices again?
Antiviral therapy, antibiotic therapy, or surgical draining?
Antibiotic.
Surgical draining.
Dang it. Why is it surgical draining? Is it
It's an abscess.
Okay.
infant has been diagnosed with botulism after he was fed honey. The child's mother was prompted to seek care because of the child's sudden onset of neuromuscular deficits, which were later attributed to the release of substances by Clostridium botulinum bacteria. Which virulence factor contributed to the child's illness? Endotoxins, adhesion factors, or exotoxins?
What was the other one besides endotoxins and exotoxins?
Adhesion factors.
I'm gonna say the exotoxins.
Very good. A 33-year-old patient who is long-term intravenous user of heroin has been recently diagnosed with hepatitis C. Which of the following portals of entry most likely led to the patient's infection? Direct contact, vertical transmission, ingestion, or penetration?
What did you say before vertical transmission?
Direct contact.
I think I'm gonna go with vertical transmission.
Penetration. IV user of heroin. Gotta penetrate the skin, right?
Shoot, yeah.
A hospital patient was swabbed on admission for antibiotic-resistant organisms and has just been informed that MRSA is present in his growing. The patient has normal core temperature and white blood cell count. The patient is experiencing which of the following? Infection, proliferation, colonization, or inflammation?
I don't think we went over MRSA. What? Can you remind me what MRSA is?
Methicillin-resistant Staphylococcus aureus.
And what were the choices?
Infection, proliferation, colonization, and inflammation.
Is it colonization?
Very good.
But can you go over what MRSA is again? I feel like I don't remember reading anything about MRSA.
It's a staph infection.
Okay.
It's a staph. It's just what it is. It's a staph infection that's resistant to methicillin.
Right. Okay.
So that'd be contact precautions, right?
Yep.
All right. Chapter 6. Genetic disorders that involve a single gene trait are characterized by multifactorial gene mutations, chromosome rearrangements, or abnormal numbers of chromosomes.
You said multifactorial?
Mm-hmm.
And what were the choices?
Genetic disorders that involve a single gene trait are characterized by multifactorial gene mutations, chromosome rearrangements, or Mendelian patterns of transmission.
Is it the Mendelian patterns?
Very good. Ultrasonography is most likely to detect which of the following fetal abnormalities? Neural tube defects, skeletal abnormalities, or chromosomal defects? Ultrasonography is most likely to detect which of the following fetal abnormalities? Neural tube defects, skeletal abnormalities, or chromosomal defects?
I'd say skeletal.
Very good. Which of the following health problems may be identified by a torch screening test? Rubella and herpes, rhinovirus, chlamydia and rickets, or human papillomavirus?
Torch. I should know this. What was the first one that you said?
Rubella and herpes.
No.
Yes.
Oh, dang it.
So do you remember what torch stands for?
I have it here somewhere. I know it has to do with OB, like the birthing process, right? Does it?
Um,
No?
yeah,